just going to wait a few seconds to make sure that everyone is joining us. Just to make sure we've got as many people as possible who can hear from our fantastic holistic vets. Perfect. So we're just going to introduce them a little bit and let them introduce themselves, more importantly. So we have Chelsea Dawson, we have Amy, and we have Charlotte, or Charlie. So if we can just go one by one and explain a little bit about, what makes you holistic and exactly kind of what you kind of do differently, that'll be fantastic. So let's go with Chelsea first.
All right. So I'm Chelsea Dawson. I have a company called True North Veterinary Wellness. I have expertise. I've got a GP certification in chronic pain management and acupuncture, Western veterinary acupuncture. I also do Western herbal medicine. I teach both acupuncture and veterinary herbal medicine. I dabble a little bit in nutrition, but mostly I ping all of that stuff over to Charlie. I do a bit of behavior. I do quite a few different things. So I'm based in the north of England, so mainly covering sort of East Lancs, West Yorkshire area.
Fantastic. So we'll go down to Amy Watson. You're next.
Hello. So I'm Amy. I am based down in Dorset. Lovely sunny Dorset between Salisbury and Bournemouth, and I do a fair range of things. I do a lot of what Chelsea does, so I do a lot of acupuncture. I have my certificate, my international veterinary acupuncture certificate with that. I am a certified canine rehabilitation therapist, and I use laser quite a lot in combination with various other treatments. And I also am just finishing my advanced certificate in Chinese herbal medicine for animals. So I do a lot of Chinese herbal medicine. And then Chelsea's attempting to teach me to do Western herbs.
Attempting? I did teach you.
I still feel like a newbie on that.
That course is excellent.
Fantastic. Perfect. And Charlie, over to you.
So I'm the most conventional based vet, I suppose, in the room, in that my general practice, I still am conventional. But what happened is that I ended up kind of moving into primarily nutrition 4 years ago. It gradually got to be a bigger and bigger part of my job. So now actually the vast majority of my job is now clinical nutrition. So treating pets with dietary managed or dietary supported medical conditions by altering their diet. And I actually now work with several companies. Some of them I work self-employed, including commercial formulation of prescription diets, things like that for pets. Last year I was on the PFMA raw food and veterinary nutrition committees, and then I also teach. So I teach other vets too. In fact, we've all been on each other's courses. So I also teach both pet owners in terms of how to formulate with fresh foods, and I teach vets on how to do clinical formulation for owners with medical conditions.
Perfect. So essentially the point of these webinars really is so that anyone who is watching can ask as many questions as they want, and we'll put those to the floor so we can get any answers, because of course a pet is a very valuable part of the family. So we'd love to hear any feedback. So if you have any questions, please put it in the chat and we'll see what we can get around to answering as many as possible. I thought I'd give a little bit of a backstory really as to how we know you. So I first met Chelsea actually as a pet owner. So I took my 2 dogs along. Mainly because I wanted to see the difference. We've always treated ourselves and our family very holistically, but for some reason in the past, my animals, I've always taken them very, very conventional, not always with the best outcomes. And it was actually Jessica who said, why don't you try actually seeing what their health is like before they get sick, which was a total revelation. We've always done it as a family, but with a dog, I was like, really? So I took her along to Chelsea and watched her do a full assessment on my dogs. She changed their diet. She also checked all their joints out. And I went from having 2 dogs who I thought were fit and healthy to suddenly having 2 dogs who were unbelievably active. They slimmed down, their muscle definition changed. I had a dog who couldn't jump on a sofa who could suddenly jump over the back of a sofa. It completely changed their overall health.
Skin improved too.
And they are much, much healthier because of it. And you realize, gosh, I can't believe I hadn't done this before. Why not take a dog who's relatively healthy and actually make them even healthier so we don't get those problems later in life? And Chelsea actually transformed them, which was fantastic. Thank you.
And that must have been, because I've not seen them for ages, it must have been at least 5-6 years ago.
Yeah, they've just turned 8.5 and they have shown absolutely no signs of poor health. And that diet is unbelievable. I've never, we formulate our own diet, but I've never thought of formulating a dog's diet like that. But also you made my life 100 times easier, because instead of, you know, doing the food myself, I now get it pre-made. And I was like, wow, it's easy. Take a sausage out the freezer. And they love it. And it was that combination, you know, you look at it and go, oh, I'm not now nutritionally missing something in their diet. I know everything is perfectly in there. But their health, I couldn't believe it. Literally within a month, they dropped, you know, 0.5 kilogram to 1 kilogram each, which doesn't sound like a lot, but that was enough to see all their muscles, and they just look perfect.
One of them was a little bit overweight, just
stocky, stocky,
and slimmed down and became super stocky and athletic. And the other one went lean and beautiful.
It was more the fact she couldn't jump on the sofa. I mean, I don't know why I'm just keep talking about the fact my dogs, they're never on the sofa, of course. But if they could, she couldn't do it.
We're not judging. We're watching.
It's all right. My cat will do something really horrendous in a minute to make any behaviour your pet has ever displayed look really fine.
It's watching, you know, the health of your animal change, and also, you know, the fact that I think we all in the living room kind of went, oh, when she literally just bounded over the back of the sofa and looks as if to go, what? It's fine, I can jump. Like, couldn't a week ago.
I think it's nutrition more and more and more. I think even from when I first saw you with your dogs, nutrition has become even more a big part of what I do. And because the majority of what I see is pain management, musculoskeletal, it wasn't a topic that I touched on very often. It was more if I was seeing, you know, when I was in general practice, seeing skin cases or, you know, digestive issue cases, that sort of thing. But I think more and more now I'm looking at diet, even in cases where you wouldn't necessarily think diet.
It's like people. I mean, we have the root cause of diet and gut health, and I think you realize that animals are exactly the same. We've just we haven't done that as much.
Yeah. Well, I said that to a client the other day. I was doing an assessment, had never seen this dog before, and we were talking about changing her diet to a fresh food diet, cooked, not a raw diet, this one. And I was saying for myself, I mean, you guys know I've recently changed my diet in the last few weeks because of musculoskeletal issues. And I'm amazed, and I don't know why. I mean, I'm the same as with you guys, not thinking about your pets that way. I'm rubbish at taking care of myself, but my dogs are in great shape. Just that diet change has made such a big impact, and I wasn't changing it for skin issues or digestive issues. It was musculoskeletal problems mainly that I was having. So I was having this conversation with a client just this week, saying, you know, I know it doesn't seem like it, but I think there's a difference between surviving on food and thriving on food.
But it goes back to that phrase, doesn't it? Let food be thy medicine. And actually, herbs just take that further, because again, and from a Chinese medicine perspective, actually, when we do acupuncture, we can move things around. We can try and nourish the underlying organs so they work efficiently to make those fundamental substances. But we can't put anything into the body, in effect, by doing it. For that, we need therapy, Chinese food therapy, for example, or we need herbs.
It's fundamentally, it's why we get on, isn't it? It's why this works. It's why we all go to these kind of we all go to each other's courses and go, aha, because the whole thing links. And you know, I've sat there and spoken to Western herbalists and Chinese herbalists, and despite the fact I'm none of them, I am still a nutritionist, which means that you sit there and you go, okay, well, that, you know, Chelsea's course teaches a lot about how the mechanism of action of herbs, and then actually you say, okay, well, that's food. At the end of the day, it's just food, isn't it? And
food are herbs that taste nice a lot of the time as well.
Exactly, so it's all the same thing, which is why we work quite well together, and why realistically we're all a bit similar in the way we approach stuff. You know, we look at a dog and we don't say, okay, what do we need? I mean, it's not that none of us use medication. We do when it's necessary, but we you know, tend to approach it from a nutritional and a herbal perspective too. But you know, it's a much bigger picture than commonly gets approached in general practice, isn't it?
Must be more tricky though, I suppose, because, you know, at least a human can tell you what's wrong and what's going on, whereas you have to rely an awful lot on, you know, kind of feedback of what you can feel, what you can see, you know, sensing also when they're in pain. I suppose an owner would kind of know if their behavior's gone off, but it's not as easy as
but they don't
ask a patient.
But just because you've had a behavior change doesn't necessarily mean that they associate it with the underlying reasons.
They don't.
That classic of dogs that get older, that become more noise phobic. From our perspective, we go, okay, where's the pain? Where's the source of pain? Because this animal clearly has
what's wrong with you?
Yeah. Whereas if you're a client and you go, my dog's getting older, it's got noise phobia, well, that seems to come with them when they get older, and they don't necessarily think it's because they're painful.
Because they're pain,
and getting clingy and older dogs that have, you know, clingy separation anxiety, you know, and people get really sort of hung up on the fact that the dog's just gotten old and senile and is losing their marbles. It's like, no, they're painful and they're sad about it, so they've gotten clingy, and that's it's
and a lot of cognitive dysfunction. I think it's great that we recognize it in animals now, but I think it's almost overdiagnosed sometimes. And we now, what is actually pain, you know, dogs that are up pacing at night, that kind of thing.
Yeah.
Very easy to quickly go, oh, they're starting to lose it a bit.
And how many of those dogs get fixed with porridge? Like,
Chamomile porridge. Chamomile porridge is one of our favorite things.
It's just porridge. That's literally, you don't need any medical degree of any sort for that. Porridge. If you've got one of the old dogs that are pacing at night, some of them have got orthopedic pain, obviously, which maybe won't be quite so well treated by that. But then you get dogs with this kind of chronic digestive pain. Chamomile tea porridge, best thing.
So explain how you make that for people who don't.
Well, I make it by making chamomile tea by putting a teaspoon of chamomile flowers in a cup and then putting a lid on it. Chelsea taught me this. Put a lid on it to brew.
It keeps in the compound.
Yeah, absolutely. And then I make porridge separately. So then I make my with water, not milk. So I make my porridge separately, and then I stir the two together to make kind of like gruel, chamomile gruel.
Just out of porridge oats, and how you
just porridge oats.
And how much would you give them?
10 grams for a terrier is what I do, but I don't know. I mean, I actually have never asked Chelsea how much. I kind of based that on the fact a human has 50 grams of porridge.
Yeah.
Terrible logic. But you know what? It really, for me, I just factor in that number of calories per day, and because I balance recipes in a really kind of creative way anyway, I just factor it in. But I think 10 grams per 10 kilos sounds
So you'd give them that at night before they went to bed?
Yeah. And loads of those dogs that have got that kind of refluxy, acidy feeling that just, you know, heartburn. It's what humans would feel like, heartburn. And so many of these dogs that have just had chronic diseases and have come to you for consults as a last resort, and you say, porridge, and they go, and actually it's bloody brilliant.
Porridge is nourishing. It's super nourishing.
Fair, I can't take all the credit for it because it was Virla.
No, it was Virla. And I'd really like to pronounce her surname so you can go find her, but I actually can't.
We'll look at that in the resources afterwards.
The porridge was Virla's idea. Yeah, but it's
lovely because you've got the oats that are nourishing, but also have sort of
chamomile that's
properties, and then the chamomile. I mean, chamomile. Everybody needs to have a good quality bag of chamomile flowers in their cupboard.
And can that be given to animals, cats as well? Would it be given to cats?
Chamomile, you've got to be a little bit careful with how much you give to cats, just because of the degree of essential oil that's in it. And cats can be really, really sensitive to essential oils.
Okay. Yeah.
So it's not one that I use as much with cats. Cats are a little bit trickier when it comes to sort of anything that's got more sort of volatile oils or essential oil in it. But definitely for dogs, chamomile is brilliant. I use it for everything, absolutely everything, and it's easy and it's safe. It's such a safe herb, and it's just a jack of all trades. It's anti-inflammatory. It's a mild nervine, so it's calming, carminative, so it reduces gas in the digestive tract. So that's why it works out so well, and it's a nice, easy, safe option.
I have to say, ever since you told us that on our webinar when we met, I have to say I very quickly went out and bought a very, very high quality chamomile because you were like, everyone should have it in the cupboard, and I was like, I don't.
We've been drinking for ourselves, less for the animals, more for us.
I'm saying they're going. I'm like with a plate over my cup, going. My Chelsea says, "Do it. Whatever you do, don't put. You have to put a lid on it." I got a plate on everything.
It's great, but I think it's definitely a useful one for those dogs up at night. But going back to the behavior changes, I think now the recent this is an estimate amongst veterinary behaviorists, but 78% of veterinary behaviorist referrals are pain.
Wow. Well, that was our next question about what you treated most commonly, and it sounds like pain is definitely. And is that joint pain? Is that? How would you know where the pain was? How would you?
So I guess it depends, because I think we get hung up a lot on orthopedic. So most vets, and even myself, when I was a new grad and in general practice, an animal comes in showing signs, whether that's lameness or whether that's a behavior change, signs of pain, and we immediately go to feeling joints. As time's gone on, and I've done my qualifications in pain management and got much more involved in that, there's a lot more subtleties to it. Focus a lot more on muscles, myofascial pain, looking for trigger points. even picking up on subtle changes for, we can't say definitively if animals have this, but we can kind of guess if they've got things like allodynia or hyperalgesia. So that's when pain is so bad that touch or non-painful stimulus feels like pain. Obviously in humans, they can tell us if they've got that. With animals, you've got to read more subtle signs. So I think, and probably Amy definitely with what she does, which is similar to me, I think it's just been a lot of practice and getting good at reading the signs.
It is.
I
And
think it is.
it's looking at how they move. So just by starting with that gait, how do they stand? Have they got what I call a dorsal pelvic tilt? Are they keeping those back legs tucked underneath them? Actually, that's much easier to do. If you've got pain in your joints, you'll do that. You don't necessarily want to extend. If you've got no muscle because you've had pain and you've got disuse atrophy to those back legs, you'll keep them tucked underneath. If you've got a lordosis, actually that's quite uncomfortable. So then it's like, well, okay, fair enough. The ones that look like an elephant on a tub, the front legs are full and they're like that. I can't demonstrate it very well. Because they've basically gone, what do I do? I'm painful everywhere, so I'm just going to do this.
Yeah.
All that head's kept down. Why is their neck not up?
Or why does it have no neck?
Triangle.
Really?
Yeah. Hypertrophy, enormous at the front, the tiny, weeny little bottom. And you're like, and they're then coming because they're lame on a front leg, and you're like, actually, the whole issue's been at the back
it's
the whole
not.
way
Yeah.
through. They've been throwing the weight to the front. They've got this like hypertrophy, and then you've ended up with degenerative joints because they've overused that joint for some extent. So then you're kind of feeling, okay, and it's exactly as Chelsea said, have you got tension in the muscles? Have you got trigger points? Has some of that compensatory? Is there a joint pain somewhere, and where is it? And you don't need to make them hurt. You don't need to make them yelp. That's what really bugs me. It's looking for those subtle changes. So there is just, as you feel somewhere, just a breathing change. All those subtle signs, and you go, that's where I think it's.
And I think it's easy to forget as well, and probably Charlie can comment more on this, is the other causes of pain. And this is something that, I was teaching an acupuncture course at the weekend, and it's something that we talk about. Don't forget, it's not just musculoskeletal and spinal that causes pain.
There's a lot more. And I mean, for me, I part of what helps me to diagnose them is that it's amazing how many times the same thing comes up over and over and over and over and over again. And I don't remember if I think both of us, like all three of us at one point, have done a webinar, like a Facebook Live about pancreatitis. And and I think something that in veterinary land, quite often we kind of get hung up on pancreatitis as the primary diagnosis for a dog. And we kind of go, right, it's got pancreatitis. And then we get really caught up. I mean, for me, the dietary aspect of it is the thing that bothers me, obviously, but we get really hung up on the dietary aspect, particularly low fat. And what we tend to forget is that pancreatitis can also be secondary, or it can be, so it's more complicated than that. And for me, the thing that makes it possible to understand, like for the dog to explain to me what's not right, is that I realize quite a lot of these are secondary to things like IBD. So
inflammatory bowel disease.
So quite a lot of them have got food allergies or food intolerances that are the reason that they have abdominal pain, and the pancreatitis is sometimes not the primary issue. And so we continually kind of the general approach of conventional nutrition, as it were, is to just keep low fat. And for me, to me, sometimes it's just the fact that the dog isn't better, and the fact they've gotten as far as me means they don't just have pancreatitis. So sometimes I don't need the dog to say anything. What I actually need is a failure to resolve on the conventional path. And then I say, okay, then we need to look at these really common issues. Same with particular breeds, the kind of brachycephalic, short-faced dogs. So bulldogs, Frenchies, lots of those have got reflux issues, and the owners don't always realize what it is, and the dogs don't vomit. So nothing actually comes up. All they just do is kind of gulp and just look a bit weird. They just kind of look a bit hunched, and but because I know the breed really well, Chelsea's got one too, like lots of vets with short-faced dogs. But by accident. But you get to know, if you know the breed really well, you can read them better. And I think in some respects it kind of helps to have a bulldog at home, actually. I don't know if Chelsea feels the same, but I feel like it gives me a better read of similar dogs.
I've felt like that about lots of different breeds. I mean, I've had various breeds over the years and fostered lots of different breeds. And in general, they're all the same species. So in general, yes, they're wired up the same, but there are definitely certain characteristics. So, years ago, I fostered an English Bull Terrier, the ones with the big noses.
Yeah.
And this guy, oh, bless him, Reggie, he had all sorts of skin issues. He had all sorts of eye issues. And I always thought of them as, I hate the word dominant, but a bit of a dominant breed. Like, not aggressive, but just very in your face. And other dogs didn't really like them and whatnot. And it wasn't until I had one in my house that I realized they're not dominant. They just can't see past their nose. So they have to get on top of things to see it. And I was watching this poor dog bowling my dogs over.
You just can't see properly.
And dogs are like this is going to deteriorate now because like dogs, like bulldogs that are really flatulent and have gut pain, and owners are like, oh no, it's got gut pain, and they come to a nutritionist, please sort out my dog gut pain. And then those dogs, I get them to send me a video of it breathing when it gets back from a walk. Usually it's not that, it's upper respiratory trouble. They're swallowing air. So that's another
breathing through their mouth.
Because they're struggling to breathe, because they have not all of them, but it's another good example of like how you can figure out what's wrong with them just by what they are, even from a distance. So even despite the fact that most of my clients are actually distance clients now, doesn't make any difference. I ask for a short video because I know what I'm looking for, and it's either there or it isn't. And lots of these dogs with gut discomfort that are short-faced, sometimes it's, pancreatitis, IBD, whatever. Sometimes it's just air swallowing because their respiratory system is so compromised.
And I think
what would you do about that? How would you?
It depends how severe it is and what age the dog is and things like that. Obviously, some of them have got gut issues as well, so certainly you can do things like feeding them in a way that encourages them to eat more slowly. That helps if eating is an issue, because some of the dogs that eat dry foods that are short-faced like go like that with it, and as a result they just swallow a phenomenal amount of air and give themselves gut pain. So there is a dietary approach to it. I would have to say though, there is quite a lot of those dogs need surgery, but it's important for us to be able to pick those things apart, because I feel like it tends to be the case that we get really carried away down one avenue, and a lot of these dogs get recommended just surgery, and a lot of these dogs get recommended just diet. And actually where I sit in the veterinary world is to sit right on the fence and say, okay, right, I can see down both sides. Let's decide which side to do first, but I think breed and experience, isn't it? That's what it is. It's experience. When you graduate, you know lots of knowledge, and then over the next decade, what you actually do is you figure out how to speak dog or cat or horse, depending on what you work with.
It isn't much different than people. I mean, as much as I said that, you can talk to a person and find out what's wrong, the amount of time a person tells you what's wrong and you go, no, it's not really.
No, and also, I agree. I think people probably tell an awful lot of fibs. Like, I'm fine. That comes up all the time, no?
But you're kind of programmed into that one when you go, because I mean, how many times do we go, how are you? How are you? And you go, I'm fine. And then you shut the door and you go, and how are you really? Everything hurts, and you get an absolute nightmare, and you're like, so why did you say fine?
Just reflex, isn't it? Reflex, I'm fine.
The nature of the. Oh, sorry, Amy.
Sorry, clients will often say that to us. You'll kind of go, so how are they? Oh yeah, they're fine, because they don't want to tell you that actually they're not quite fine. So I have quite a nice tack on my part, because I usually tell my clients, I'm like, anything that changes is useful information. For me, there is no such thing in Chinese medicine as a side effect. It just helps me steer to the right pattern diagnosis if I'm slightly off. So I need you to tell me exactly what changes, and I will never ask you if they're better. I will ask you what's changed since I last saw you. I get a lot more information that way, and it works beautifully, and it means that people are really honest, and that's lovely.
It's a good question. It's a good question. I like it. I think I might be stealing that one in my own practice. That's
good. It also stops them going, no, I don't feel any better.
Yeah.
Yes.
Exactly.
Relevant.
Exactly.
I think because of the nature of what all of us do, I think because we're not treating our patients, Jess and Sandra as well, from the outside in, we're treating from the inside out. It is all of those, we look at things really differently, and it is much more subtle cues, and it isn't just about I hurt here, which is usually what I say to Sandra.
Hurt here. We have a national habit when someone goes, oh, I'm in a lot more pain afterwards. We go, yes, that's great. That means we had a great reaction. Sorry, I should have done the nice normal thing of going, oh, you poor thing. That's great. Sometimes a nice big reaction. It means something good. It means something changed. It means we had a nice, along the right path. Your body started to actually focus on it, which is good.
We got your body's attention. We got your brain's attention.
We often see people go worse sometimes a little bit before they go better as well. And I don't know if that's the same with animals when you change their diet, that you sometimes see that they get more symptoms or they get things come up a little bit.
That's an interesting topic, because there's an awful lot of the raw feeding community is a strongly opinionated one, and I'm not one of the most strongly opinionated, so I'm very much more there's certain diets suit certain dogs. I'm much more practical or much more open-minded about, some dogs will be more effectively managed with home cooked than raw and so on. But actually there is this term detox in raw food, and it gets frequently misused. So whilst there are most certainly adjustments that a dog would need to make to any new diet, so your gut enzymes have got to change, your biome's got to change, you have got to change the way your body behaves if you change your diet. However, there's an awful lot of people who use that as an excuse for negative effects of doing it badly. So that's kind of where I really enjoy formulating with decent accuracy, and trying to approach something very much with that individual in mind. So things like trying to approach a particular fat level or a particular level of zinc. That's my favorite. Particular zinc levels, particular mineral profiles, to try and reduce that part, because you're right, some dogs will have problems when they change. But given the vast majority of dogs I'm dealing with are already pretty sick in the first place, I am really careful to try and minimize that as much as I possibly can. And so I don't tend to use the term detox in that context, because I think that it gives people a feeling that any kind of negative change is normal. And I think I'd rather they assumed all changes were not normal and told me. And then if I say, okay, don't worry about that one. And we've got a lovely little dog who's actually an Australian client who had really severe IBD as a young dog, like really early onset, 9 months, something like that. And she's now really stable, brilliant dog. And we're just looking at introducing more ingredients so this dog can progress to a diet that fundamentally just has less powder in it. I know that sounds like but we had to supplement this dog quite heavily early on because it couldn't eat food, like so yeah, we were in just such a tight spot, so it had quite a lot of supplements, but we'd like to not do that forever. And what we were just discussing the other day is the fact that whenever we introduce a new ingredient to this dog, it has a little bit of mucus on its stool. The dog's not uncomfortable, it doesn't go off its food, there's no nausea, there's no reflux, there's no discomfort, and it doesn't lose its appetite. And it resolves within 2 days. That's the kind of change I'm okay with. But yeah, I tried to do it really carefully to limit that when I can.
Yeah. I've definitely had patients that have changed on to raw diets, just on their own accord. And then when I've seen them, they go, well, they're just detoxing. And we're like 3 weeks in, and these dogs had raging diarrhea for 3 weeks. And
But that would fit with the traditional Chinese medicine a bit, wouldn't it? I mean, the traditional Chinese medicine has a different view on raw versus cooked and other things. I don't know if that applies to animals as well.
Yeah, we would say so. It's interesting because a lot of the sort of processed foods are kind of pretty carbohydrate based. So you're kind of like, they're really damp generating. So I can't even try and explain damp. Chelsea and Charlie will know I've attempted, and it's very hard.
Damp's a pretty mild and sensible term from you. It could be far worse. Like sometimes it's just a run of sometimes it's a massive run of words I don't understand.
Damp is a lot allowed to say now.
So damp is this sort of, how do I describe it? You'll sit. So if you get mucus on the stools, it's damp. That's classic. That greasy coat is damp. There's excessive eye bogies. That's damp in my world. Okay, and it's often because the spleen's not working. So the spleen in Chinese medicine, as you'll know, is that organ that's involved in transformation and transportation. It's a digestive organ. Actually, if we think about
like the digestion, I think, isn't it? I think you just use the word together. I often just use them the same.
And actually, because it's interesting, because you think about where spleen and pancreas sit next to one another, you can kind of understand why the Chinese went, oh, well, there's the spleen, the organ of digestion. You're like, well, it sits next to the pancreas. So actually, if we just call it spleen pancreas, then you start to kind of maybe see a bit of logic coming through. So, but if the spleen is not working effectively, then you get excessive production of this damp, which you can't really deal with, and then you sit and so on. So yeah, changing foods, raw foods cold as well. If that cooking, that stomach, that ripening, rotting vessel with cold anyway, putting more cold into it probably isn't such a great idea. If I've got a dog that's massively spleen qi deficient, so its digestion is not maybe so great, there's a home cooked diet better to start with to build up and then maybe move. And I think that's it. It's just a case of what's right for this patient.
Yeah.
To my mind, raw food is not the right way to go for all my patients by any stretch of the imagination.
Same
It-
for it's
you know,
very similar to an adult, a human though, isn't it? Because I mean, if you're very stressed and very tired and quite run down, the last thing you want to do is throw loads of raw salad in. You want to do nice, steamed vegetables, nice easy broths.
Yeah,
Try
you've already done a little bit of digesting by cooking it.
Yeah, exactly.
Yeah.
So we always go for. Yeah.
I
I
always
always
find
find
probiotics. Do you give probiotics to animals? Do you do probiotic supplements?
you do. I'm getting less convinced. I don't know about everybody else. Like, so in some situations I can absolutely see the purpose, and I think I see benefit. So adding them to dogs that have had to have antibiotic therapies and things like that, where there's a reasonable possibility there's a problem. But very often I feel like, certainly in veterinary practice anyway, we throw them at stuff where they're really not going to help because we're not addressing the underlying problem. Because a lot of the dogs that I meet that are on probiotics, they've got IBD already, or pancreatitis, or exocrine pancreatic insufficiency, or some other problem. And what's happened is we've kind of thrown these probiotics on top and kind of hoped that the sprinkles will sort the problem out. And actually what I find myself doing 90% of the time is throwing everything in the bin and starting again. And then addressing the biome by correcting the diet and reducing the inflammation, rather than actually hoping that throwing a few extras in is going to really, I feel like a bit like
I think
people would say weeing on a bonfire sometimes.
I think with the nature of what you do, because when people are coming to you, they're looking for
yes,
diet.
true. I only see the bat. Yeah, it's
And
probably
I think where it's possible to completely change diet or address diet or formulate or that kind of thing, I think I still find probiotics quite useful, like you say, in situations where I've been on antibiotics and that kind of thing. Absolutely. But also, I definitely have clients that can't do fresh cooked.
Yeah,
or
when it can't
raw
happen.
diet. And whether that's because of time or finances or whatever, we're just trying to do the best we can.
Yeah.
I think it is, I acknowledge that we're not dealing with the underlying issue as best we can.
You see, I mean, I feel like I never see the benefit I want, but I don't know if that's just because the cases I get tend to be the refractory ones.
Yeah,
I'm not sure if that's why.
It's also, I think you need all the things together. We talk in functional medicine about the weed seeding and feeding, and you need all of those factors. You can't just put the probiotic in.
Yeah.
You have to have also dealt with anything there that shouldn't be there in that balance. And I think also then you've got to put the right nutrition in the first place to allow it to grow. You've got to, the prebiotics is what we look at, which is the same with good food.
Yeah, I was going to say
that's actually
it's far better for prebiotics than it is for probiotics. Well,
yeah.
The
And I
research
think doing herbs and things, we're using lots of prebiotics.
Yeah.
and if you're
that's what herbs are.
Yeah. And if we're changing to to a less processed food, you've usually got, I say to some extent, more variety. But if you're just feeding a bag of kibble, first of all, even the manufacturers say you're supposed to vary around them to make sure it's balanced. But if you're just doing that, you're still not getting a huge amount of variety. And we know, certainly from the human field, that the variety of what you're feeding has a huge impact on your microbiome. So I think that phrase "we feed and seed" is really important, and probiotics absolutely have their place, but it's not the be all and end all by any stretch of the imagination.
Yeah, it is looking at a multifactorial way, though, isn't it? It's always the root cause, always looking at everything together. I mean, I know one of my dogs, we started trying to give her kefir only because she had a bit of reflux in the evening. And we tried messing with it, and it was only after I looked at it and went, hang on, this dog is 4 times more active than the other dog, but they're eating the same amount of food. Is she just hungry? So I said, let's just feed her more food. So we fed her more food. It just vanished overnight. I was like, so basically you were starving the dog, and you thought kefir would fix it.
Yeah.
that's a common trouble. It really is really common. And I think I find myself in an environment where I think people feel like from the outside feel like I'm dealing with really complex cases. Actually, most of the cases I'm dealing with are really simple. And I mean, the things that I teach in the courses sometimes, or just when I do short courses, we did some free short courses for a bunch of vets, and actually things like how many calories your dog is eating. Sounds like a minor thing, but certainly there are dogs where you find yourself investigating weight loss, for example, when actually the problem there is just that the dog requires more calories than you thought. And and I know that sounds really silly, but it just is. It's amazing how much difference you can make with a tiny amount of knowledge in nutrition. Like vast difference.
And where would someone go if they wanted to find out more, if they wanted to know how to feed their dog? Where would they go for that?
Challenging. So unfortunately, the veterinary nutrition world, there is no so in any other field you would have the GPs, and you would have your certificate holders, and you would have your kind of superheroes, your board certified bunch. Unfortunately, in nutrition we don't have a certificate, which means that you get GPs, and then you get GPs who really, really like nutrition and do it a lot, and then there's 3 board certified nutritionists, and that's it. So in terms of veterinary search, it's quite difficult. That you will find vets, a lot of the vets from the British Association of Veterinary Herbalists will have an idea of where to send you, because there are people like Chelsea who have, and Chelsea and Amy can both formulate. They're like kind of sitting there like quietly, but both of them are capable of formulating diets for a lot of the cases that I would work for. So that's quite a nice place to start, I think, is that group. Is it BAVH.org?
I think it's
Herbal Vets. Sorry,
Yeah.
herbalvets.org. I'm currently under more than one name at the minute. So for me, I'm just companion nutrition if I'm on my own. But I also am currently working with a company called Vet Chef. And that is right now, it's new. But behind the scenes, I mean, we're quite excited about what that's going to be, because what I've found really difficult, but this is exactly the problem that you've just highlighted, really, which is that accessibility to this information is really limited. And it's really difficult for the few of us that do it. There he is. There you go. It's really difficult for the few of us that do formulate, that do deal with nutrition in this way, in the kind of holistic fashion, to keep up. And I genuinely can't. I genuinely cannot keep up with my emails for love nor money. And what we're trying to do with Vet Chef is create a way that everybody can access it. So for example, if someone were to contact me, or this happened the other day, someone contacted me with a dog that has renal failure but needs a diet that contains very specific things, partly because it has allergies, and then it also only eats certain things. And so I find myself in a position where we need a diet that contains tuna and beef or something like that. It was a bit weird. So what we're doing is that then, rather than just being given back to that one owner, so rather than us just saying, okay, Bob, this is your diet, go, I create that diet, and then I label that diet and give it a set of rules. And I say, okay, this diet would also apply in this, and this situation. And this is how you would adjust it for different weights. And this is how you would calculate the calories. So basically I double the length of work the first time around, but that then means that the system can search you a recipe, and another dog with that exact same set of criteria will exist. There will be another one somewhere around the world that needs that diet. And the second time around, that dog can access that diet without me.
Yeah.
And whilst that does sound a bit stupid, like I'm cheating myself out of a job, it means thousands and thousands of dogs will be able to find clinical recipes.
It's a bit behind human dietary, really. We've done a lot for human diet, and we haven't done much for animal diet at all. We've just done it very classically.
Yeah.
Yes. Yeah, it's really changed. It is. So we've got some quite good statistics though on how much it's changed. So we know that the number of people feeding raw diets has increased 4-fold over the last 10 years. And we also know that the number of people feeding home diets in general, so home prepared diets, one or another, is doubled since 2008. So we know that there's a phenomenal number, and I think the number now is I think it's 64 home prepared raw. So 64% feed some home prepared or raw food. That doesn't even mean that 64% already excluded dogs that fed just treats. So that doesn't include throwing the dog the toast crust. Those people were excluded by the study because they don't really count. It was people who were actively feeding their dog home cooked or raw foods on purpose, and that's a lot of dogs. So it's changing rapidly, and we need as a profession to catch up. And I'm really hoping that Vet Chef will help me to help that happen. Which is kind of why I took that position, because I can't do that on my own. I just don't have the manpower. So I'm kind of, So at the moment, potentially that will be a brilliant place to look.
Yeah, I think it sounds great. That's a great resource.
It really is.
So if we ask, we've had a question in by email, and I don't know who wants to answer this one, but as to what could be triggering a seasonal allergy in a cat, as apparently the pollution app says that the allergens are low, which sounds like it's not outdoor. So is there anyone who wants to answer that? Who wants to do that?
It's a long list.
Yeah. It's hard. I think allergies in general are hard, and I'm sure it's the same with people and animals. We mainly talk about dogs, but cats, horses, any animal can be allergic to anything.
Same as
The
people.
same as
It's a
people.
nightmare. And can you test for it? Do you do tests for it? We can test for it
We
with blood
do,
tests.
yeah.
Patch
They're not-
tests?
Intradermal testing is more accurate but less easy to come by. So it tends to be the case that we do blood testing for antibodies, which is not terribly accurate, although is sometimes helpful. Certainly I do use it, but I don't jump to it first up very often. I think for that dog, that cat, sorry, in the habit, with that cat, I'd be probably looking to make some kind of diary of when it happens to try and associate it with things that have happened, because that'll narrow your search. So dogs, in my lifetime, in my own house, I've had a dog that had seasonal allergies that were primarily a problem in the winter. And actually we did eventually antibody test this dog, and it all kind of matched up in the end, which is that she was allergic to a whole lot of household allergens, so things like dust mites and storage mites, which is why the problem was more obvious in the winter when she spent a lot of time indoors. And actually, this sounds really mean, but the solution to that dog was that she started sleeping outside in a kennel. And that sounds really ridiculous, but it solved the problem completely. So I think, trying to make a diary of what happens and when it happens in relation to changes of season, changes of environment, changes of behaviour might help you to identify at least what area you need to look in.
I think indoor environmental factors.
Yes, as well as outdoor.
So
not
the same as you would for a child or a baby.
Have I changed my
central heating on?
Central heating, yeah.
To produce those, those convections in effect. That's, I can't remember the physics. Suddenly we're dropping in the air, all the dust that sat around whatever is up, and that can cause irritation. And interesting, I walked out the house yesterday morning, and I thought, is that like a light rain? But it's sunny. I can't stand it. It wasn't. It was stuff coming off the trees.
You do see quite a lot even now. Exactly.
So although the allergen levels are low, actually it was supposedly low. I'm always kind of slightly dodgy about those apps. There is still stuff out there, and the trees have done weird things this year, and the plants have done weird things.
Well, the season's really abnormal, isn't it? It's really odd. They cut my hay in like mid-September. This year. It's really odd.
What about any herbs that might help with that, or anything that might help them be less reactive? Is there anything that you used for that to try and reduce reactivity?
I'm going to throw that really generic answer at, which is it's very difficult to say without seeing them. And I would suggest that if you're going to consider it, it's easy for us to go, try this, that, but you actually need to see a herbal vet, because we all know herbs are not inherently safe.
Yeah.
It's a misnomer.
Can you strengthen them against it using the herbs? Have you found you can strengthen them against some of the allergies? We do that with people. We try and make their immune system healthier so they're less reactive.
Yeah, and so there's nutritional approaches to that as well. So you have, obviously, there's food allergies, which is a can of worms all by itself, and that obviously is a whole separate problem because you're looking at elimination diets and things like that. But if I don't know the allergen, or if it's clearly an environmental allergy, so something coming from the outside in, then we look at things that strengthen the skin barrier, and that tends to be essential fatty acids. So we use GLA from things like evening primrose oil or borage oil, and omega-3. EPA, DHA, and I use human supplements a lot of the time for that, because there are not really any very good canine equivalents yet. We've got all kinds of things pretending to be great. They've got tons of great stuff written on the front, but actually nobody really seems to approach it with enough enthusiasm on those packs, to be honest with you. So we do. Fatty acid supplementation makes a massitive difference.
Charlie and I worked on a case together with skin issues, and it was a bit of an itchy scratchy, looking at spending its life on long-term immunomodulatory drugs. And Charlie modified the diet so we had that optimal nutrition to promote the skin, and I put her on herbs. That dog is doing
my goodness. And the little brown terrier that me and Chelsea work with as well, same. She, I nearly said her name then. I was like, oh no, I can't do that. But that dog, I saw her the other day. Brilliant. Remarkable. And her hair coat even changed, the actual style. The style of her coat changed from
a patient in for skin or allergy issues. The one thing that I always say is, first of all, this is going to be a long process.
It takes time. It's kind of similar to the question that we've
holistically.
The question
is no different. It's just as frustrating. It takes as much trial and error. What my approach to it, my basic view on allergies and skin is, I'm just going to optimize all of the health as much as I can.
Yeah.
I can't get rid of the allergen. I can't, you know, and if I can optimize the gut, which we know is related to skin,
Mhm.
if we can
And the immune
optimize the
system.
skin,
Yeah.
the immune system, all of that by using a good, you know, well-balanced, nutrient-dense diet. If we can use herbs that might have some anti-allergic type effects, but mostly I'm looking at things like alterative type herbs, immune support, that kind of thing. So we're just optimizing all that, minimizing any environmental issues. So what are we using to wash the laundry? What laundry detergent are we using? Are there smelly, perfumey candles in the house? All the things that you would do for a human with sensitive skin, putting all that in place. And most of the time, it doesn't always resolve it, but it definitely makes them, you know, able to cope a lot better.
Just wondering if it can change with diet though, because we've got a question here that says that this is from Karen, that says that she has an 11-year-old basset hound that's always been fed on a fish, grain-free food, but she started to nibble her legs, making them red. Could this be the food that she's been well on all her life? It's always been the same food.
I think it might be fresh grain free.
I feel like we should all write this on a piece of paper and then hold it up and see if we said the same thing.
But it's similar, but different approach.
It might be the same. I don't know. This is not my department, but I think that if this hasn't happened the whole of this dog's life and it's suddenly happened at 11, I think it's pain. Or certainly it's worth considering whether this dog's licking its legs because it's uncomfortable. Because it's not impossible to develop an allergy at 11 years old, but it is uncommon.
Yeah.
It tends to be kind of young, middle-aged, kind of between 2 and 4, you know, when just out of puppyhood, that's when they tend to start developing allergies. And whilst you could have a trigger when they were 10, say, so if they had an upset stomach for an unrelated reason when they were 10, it's not out of the question that they could then develop an allergy because their gut barrier was compromised kind of a year ago. But I would say the majority of 11-year-old, especially breeds like Bassets, I'd be looking at like elbow pain or carpus pain.
And would they be nibbling maybe just for an area that was sore? Would they do that?
They're quite short-legged, aren't they?
Can't do that. So they'll.
Yeah, that's exactly what it is. It's that.
That's what you wonder. Are they doing that for pain?
Rubbing it.
Yeah.
The other thing, dogs, even if they're licking the front legs, it might just be because that's where they can get to. So it's more of a self-soothing thing. And it might actually be that the back hurts, but they can't get to it.
Yeah.
And we don't see it as much anymore, but there used to be something called lick granulomas. And that's when dogs lick themselves to the point where they created these big granulomas on their legs. And it used to be classed as a disease of large breed bored dogs.
Yeah.
Really?
Yeah. It's still in some of the behavior texts that's what it was. It's large breed bored dogs. What animal
attacks itself when it's bored?
Physical damage because they're bored. That evolutionarily that makes no sense. What we now know, and we don't see it as much anymore because thankfully we're all getting much better at recognizing and treating pain. Is it was pain, and a lot of it was pain, spinal pain, back pain, and it's a self-soothing thing. It's like a baby sucking on a doty or whatever. It's and that's what they do. So and it may be that the licking is a pain related, and like Charlie said, 11 years old, Basset hound. Bassets are long back, short leg dogs. Prone to joint and back issues. So that's where I would look first. But it could also be at that age that something else has changed, like Charlie said, that's compromised the immune system in some way, which has made them more prone to being irritated or allergic to something else.
And also looking for hormone disturbance at that age that might cause you to develop an allergy or develop a sensitivity that you didn't have before. But I didn't think about that. But things like thyroid problems at that age in a Basset as well.
And would their vet check for that, or would that be something you'd want to go to a holistic vet for? Would then,
a normal vet can check for thyroid. Yeah, it's quite common. I mean, it's quite a common problem, and there's other symptoms that would make you look for it, like the pattern of which parts of the skin are bothering them, and things like weight pattern and stuff like that would give you an idea. But I mean, for me, any dog that is suddenly got a problem that it didn't have before, when it is 11 or 12, makes you think maybe there's a thyroid issue. If something's gone wrong, and they got check thyroid.
I think as a pet owner myself, I've got a question myself actually. So essentially, the first thing is, going to see a vet. Clearly, most or a lot of pet owners, they do have kind of health insurance for their dog or their cat. But if I want to go and see someone more holistic to actually work on on their underlying cause, could I still use my insurance company for that?
Usually.
Yes.
Yeah.
I think all insurance companies are slightly different, so you always need to check your policy. I think it depends. So if you have a lifelong policy as opposed to a year-to-year policy, the year-to-year policies get dodgier and trickier to work with. Lifelong policies, I would say 99% come with a complementary therapies component to it.
A bit like normal health insurance then.
Yeah.
And actually dietary doesn't even fall under complementary. I've never had a claim turned down for nutrition. I've certainly had insurance companies go, what are you doing? Like, because they don't understand what it is that we've done. And so I've had to provide the report to a few of them, but then once you provide it, they go, oh, okay, I see. And I've never had a claim turned down for nutrition, and it doesn't even fall into the complementary budget. So the nutrition aspect won't even interfere with the money you might want to spend at Chelsea's. You know,
to be fair, my consultation is a vet fee. So that doesn't fall under complementary.
No,
it's
it's
not
only the herbs themselves.
It's just what I'm, if I'm prescribing herbs, that would fall under complementary.
And is that the same for the acupuncture and the traditional Chinese medicine, the other things? Would that fall under there too?
It's exactly the same thing. I do exactly the same. I have a consultation charge, and then I have like an acupuncture charge and laser therapy charge, and then the herbs are dispensed as well. And the only thing I found is that some of the insurance companies, you have like an excess that you pay each year, which comes from your big pot of money. Vet pot, like your vet pot of money. Then you have a smaller complementary pot of money, and you'll find that they'll take an excess from that as well. And what you sometimes find is some of the insurance companies will go, well, I'm going to charge you an excess for the herbs, I'm going to charge you an excess for the acupuncture. And I have tried arguing it from my perspective but the acupuncture I'm doing is because I'm doing acupuncture from a Chinese pattern, and then I follow through with my herbs to treat that Chinese pattern. But I've yet to succeed in them not charging two excesses with that situation.
Yeah, I think there's only maybe one company that does that.
Yeah,
one or two.
They're getting smart, though, aren't they? Because I know a lot of insurance companies, even with chiropractic, are realizing now that it might cost £500 to go through a course of chiropractic, but if that prevents them having to pay for a hip replacement that costs £6,000, they look at it from a purely
this is it would be foolish. I think it will get more and more like that as time goes on, because I think people must surely start to, I think insurance companies are going to start to realize that coming to see one of us costs a few £100s, and ignoring it until they need a hip replacement is going to cost them £10,000. So
what you're realizing, actually alternative health becomes much more affordable, because you realize, but also you then don't have to put them on, let's say, diabetes medication for like 5 years.
Because they didn't develop the diabetes in the first place. Exactly. Preventative medicine is underrated, and I kind of wish there was a better insurance policy for
same for animals. I think it's just realizing your animal needs treating as much preventatively and from the beginning if we can, before they get really sick. The same as people. It saves
the pain later on as well, because you get that horrible decline later, whereas we noticed when we took a dog through the holistic care, actually they didn't do that. They just kind of they were great, and then they kind of just fell off a cliff really fast. But it wasn't that horrible 4 years slow.
You watch a lot of animals just deteriorate horribly over it's what people do. They kind of do that instead of doing
if you want that,
just what we'd like to do,
don't you? Really, basically, you want to live absolutely fantastic until you're 95, and then
die of flu or something.
When you're working closely with a vet as well, if you've got a vet who's been doing the preventative stuff with you, if you've got, whether that's a holistic vet or a conventional vet, if you've got a good working relationship with a vet who knows your pet, you pick things up much faster.
Exactly.
And actually, so that's another thing, is that having an annual check at the vet, whether or not you're doing things like vaccinations, you should do, because I think there's kind of a universal habit where people feel like the only reason to go to the vet every year is for a vaccine, and if you don't need a vaccine, you don't need to go. That's not people really should go, whether you feel like whether you think there's something you need to do or not. Go, because otherwise, by the time I see dogs. I saw an arthritic dog the other day, which was actually nothing to do with nutrition, that hadn't been seen since 2018, when it was diagnosed with really serious lumbosacral pain. And then it came in off its legs. And you just think, this is so sad, because if I'd seen you in 2019, we would have changed something. So it would have been nice to definitely come every year, because we find stuff that you maybe haven't seen.
And I think especially with the nature of the things that we do with nutrition and herbs and whatnot, even things like regular blood tests in an older patient, even if they're not on medication, there's so much more that I can do with my herbs.
So
if we keep an eye on things, you know,
Yep.
and we find that the kidneys are starting to struggle a little bit. We're not going to be going on to there isn't any conventional medication for that, but I've got plenty of herbal options and whatnot.
And
so
nutritional management, you know, we don't have to wait for them to be sick to change the diet. And
It's
things
also
like
not believing it is a cliff when you look at the blood results.
Yeah.
We do the same thing with medicine. You see the kidney failure is coming, then it's a good idea to start treating it before you get to it, before earlier on, and start supporting the kidney.
You can see them coming. It's not like they suddenly randomly appear out of nowhere.
Like diabetes, I guess. Same thing.
Yeah, you are pre-diabetic first.
Yeah.
In humans, interestingly, although not so much in cats.
Do you not
Cats
know?
and dogs. Or dogs particularly. Some of them get pancreatitis and then are diabetic like tomorrow. Which is kind of, although I suppose you could argue that you saw it coming on the grounds that they had chronic pancreatitis and were obese in the first place.
And
so I
maybe the
suppose actually you
diabetes
did see it coming. You did see it coming, just not in quite the same manner. You don't get the
The diet maybe contributed first. You know, the diet in the same way that it did with people. They just manifest it a bit differently.
Yeah, you just don't get the creeping up blood glucose so much in dogs, not so much. I think you've got more questions in there, but I don't know if you...
Was there a question there? We were all chatting.
There was a question about allergy, but I think you addressed a lot of the allergy stuff early on. I think
there's another one. There we go. There's another one.
There we go. Oh,
it's a 5-year-old Basset.
Yeah.
So Karen's asked a question about a 5-year-old Basset, which is always nervous and brought up with all the household noises, but they get worried and they've been given tablets to calm them down. But are there any herbs they could use instead? I might know the answers. I have to listen to this, I think.
I think it depends. It depends on the degree of anxiety that your dog has. So yeah, there are herbs that we can give. We've already talked about chamomile. That might help. That's a safe one. There's lots of other herbs that I use, but it all is sort of a very individual basis. So lots of these sort of over-the-counter calming things have things like lemon balm in them, passion flowers in some of them, valerian. So there's a product called Pet Remedy.
Valerian's that classic, isn't it? Combination.
Yeah. So and Pet Remedy is a spray that you can use to help. So you can spray that on collars.
It's an easy way to give it, isn't
it? Or and there's diffusers for the home. So you've got valerian's the main ingredient, but there's a few other things in that. So that's using sort of essential oils. There's one that just popped into my head.
Can I ask a question? Like, I know I'm on the wrong side.
Yeah.
Can you use a Valerian? Can you use a Valerian essential oil diffuser if you've got a cat? No.
Yes, I would use one that is designed for cats. I mean, valerian has such a strong smell anyway, so even just getting some dried root.
Horrible. It's not pleasant smell.
It's hilarious. So did you? Is it the Pet Remedy? There was a I think he was a consultant and he was hauled up for pinching a nurse's bottom and he blamed it on the Pet Remedy at home and said it had disinhibited him and that was my bottom and I just died. So
it made him so relaxed.
It knows to be strong.
I don't think we can blame the Valerian for that.
It is a very, very strong, very distinct smell.
That's hopefully not that side effect. But I think things do work well through diffusers, essential oils. We use them that way too, and through the remedies can work well that way. And I think
you've got to be careful with cats and essential oils. But I think something like cats love valerian. Like cats go nuts for valerian. And you don't need the essential oil for it. It doesn't need to be that concentrated because it's so strong. The valerian.
So how would do you get that in a preparation for a cat? Would they do it? Do they do that as a preparation?
You can get it in tablet form. You can get it in capsules. You can just get the dried root, which smells, and just use that. But the Pet Remedy diffusers are great because we know that they're safe for cats. And that's the main ingredients, valerian. But it works for dogs as well. Is quite good for that. So I think
they saw a herbalist, that they saw someone to talk about it. But
absolutely.
Yeah, and I would also be making sure that there isn't any other reason that they are anxious.
There's evidence that certain dietary changes will affect that as well. So we've got to wonder. I mean, definitely, like you say, looking for anything else. Like if they've got a little bit of refluxy gut pain, sometimes they're a bit edgy, just in general. But also, there were some good studies on. This is human studies, so I'm kind of having to extrapolate a little bit because we don't know so much about dogs. But things like medium chain fatty acids, so coconut oil. Be careful that you know nothing else is going on, but because that level of fat might make some of those other possibilities worse. But things like small amounts of coconut oil. Also, there were some fun studies in jails, Australian jails, where they supplemented with multi-B vitamins, and another where they looked at increasing omega-3 levels, and they decreased the level of aggression in prisoners.
Wow.
Because their anxiety levels were lower. So actually, for most behavioral cases, I actually supplement B vitamins and omega-3s at a level that is substantially higher than normal, because there's evidence that it might improve behavior.
Magnesium, would you use magnesium? Do you use
Yeah,
that?
magnesium I do use, although I tend to achieve that with food if I can help it, because it's easy to do. And some of the magnesium supplements for dogs make them feel nauseous, which obviously is counterproductive, because then they're clingy because they feel a bit sick. So I would say it's not that common that I supplement magnesium in a tablet form in a dog blind. I don't often do it blind, because I quite often analyze the diet and decide whether or not it's necessary. But yeah, I do look at increasing it to at least 1.5 times the minimum level overall, especially in certain breeds of dog. So there's quite a lot of evidence that short-faced dogs, like I say that I can't help it because I have too many. But yeah, short-faced dogs have a higher magnesium requirement, full stop. And we don't ever really accommodate that. And some of those stressy bulldogs and things, it's because they're suffering chronic stress, which has increased their magnesium requirements. So quite right.
So maybe we'll go back to basically, it's best to go and see a vet really and get them to check.
Yeah, exactly.
Going on.
Check everything else.
Perfect. Well, that's actually all we've got time for today. So I just want to say thank you very much for joining us. That was fantastic. I'm glad we got to ask our own questions too.
Yeah.
So I just want to thank you again to Chelsea, Amy, and Charlie.
Yep.
And we hope to talk to you again at some point in the future.
Yeah. Thank you very much.
Thank you.
Thanks.
Thanks, guys.